Hello everybody, it's Facebook Friday with Linda, Mark behind the camera.
Hello everybody.
And today we have Miss Brittany. Brittany is our newest addition to the office staff and we are very, very happy to have her. So she is going to be Dr. Gordon's IVF nurse for our patients that are going through IVF here in Knoxville. And most of you guys know Lauren, who was filling in for Megan for her maternity leave, and then Megan, I missed you, girl, but you didn't come back. So anyway, Brittany is now going to be our permanent IVF nurse, and she's been with us a whole week, and she keeps coming back. So
You better not get pregnant and leave. That's all I'm saying.
Plan on it.
Yeah, Linda's not going to be happy about that if that happens.
So, tell me a little bit about where you're from, a little bit just about general background.
I grew up in a little town, Long Beach, Mississippi, much smaller than Long Beach, California. I moved to Memphis my senior year of high school, so came into Tennessee, and then went to UT after that, and I've been in Knoxville ever since.
Okay.
Love it.
So did you go to UT in Memphis? Or did
I
you come
did
here
not.
to actually go to
Yeah,
Okay.
here in Knoxville.
Cool. So you loved it?
Love it, yeah.
It's a neat
Perfect.
place to be, isn't it?
Yeah, and I feel like you're in the mountains. You also have access to the beach.
In the lakes, all
Yeah.
kinds of lakes around here.
Yeah.
So tell me about when you graduated nursing school and what you've done since then before
Yeah.
coming to us.
So I actually went to LMU for nursing school. I did like an accelerated program. My first job out of school was on an antepartum, postpartum floor in the hospital. So we basically took care of high-risk pregnancies. If their water broke early, we'd keep them until they delivered.
Okay.
And then after that, I went to the NICU for a little bit and did that, and now I'm here.
So what was your favorite or your best liked area of working in the hospital? Was it one or the other of those? And
I'd probably say NICU. I just loved working with the babies, so that part I will definitely miss.
So show me with your hands what the tiniest baby that you've taken
Oh.
care of.
I mean, some of them can literally fit in your palm.
Oh wow. That is so amazing
Yeah.
That is
technology,
amazing.
that they can keep
I
those
know.
babies alive till they catch up.
Yep, modern medicine has changed everything about the NICU.
That is
So,
awesome.
Yeah.
Well, I happened to be in the NICU area once upon a time, not working.
Yeah.
But I had to go up and get something from one of the nurses in the same place that you worked.
Yeah.
And I remember the walls were painted with all kinds of neat kid stuff, and
Yeah.
it was just a beautiful place.
Yeah.
They did a really good job on that, and I think that's neat.
Yeah. It's a great place.
So, when you worked antepartum, is that what they called it?
Yeah.
Okay, so when you worked there, you said if someone's water broke early, that you kept them there and took care of them and tried to basically keep them from having the baby until it was
Yeah.
mature enough to survive. So, how long did you keep your longest patient that you can remember, or one of the patients that was on that floor? How long before, from the time they come in with the water broke till they delivered?
I can't remember exactly. I know we had one that came in at 23 weeks. She was really trying to do in 6, and we had to come in the next day. And I want to say she held on until maybe 32 weeks. So quite a long
So
time.
quite a long time.
Yeah. And you get the best relationship with those patients. You see them every 2-3 hours.
And you get
Or-
attached to them,
Yes.
and you get to know them. It's like family, isn't
Yeah,
it?
it really is.
When I worked oncology in the hospital, it was much the same way.
Yeah.
Because those patients sometimes are in for weeks or a month or 2 months,
Yeah.
depending.
And it was during the height of COVID too, so there weren't a lot of visitors. So we were really like
So
family.
you were their visitors and their
Yes.
family, and that's awesome.
Yeah, it was great.
So I'm sure they were lucky to have you.
It was so special to be able to be with those patients.
So tell me, your whole 5 days here.
Yeah.
I know that you did get to go in when he did a transfer,
Yes.
an embryo transfer, and you've been in some of the exam rooms during clinic, and I know that you're learning, and believe me, It took me a long time to
Yeah.
realize what in the world I was doing when
It's
I
a
was
lot.
just following orders. So please don't ever get discouraged on that. But what have you liked the best since coming?
Definitely the embryo transfer. Yeah. It was goosebumps. I don't think it'll ever get old.
Doesn't
Yeah.
for me
It
either.
was great.
So you think you might want to stick around for a while and
I
be our
think so.
permanent IVF nurse?
Yes.
Good.
You better stick around for a while, otherwise you're going to incur the wrath of Linda.
So
I don't want
we
that.
got it on camera. You heard her. She's going to be our permanent IVF nurse.
Yes.
Yeah.
She's never leaving us.
Yeah, that's right. You don't want to try it.
Yeah.
Just ask she who shall not be named.
No.
We don't even say her name around here anymore. Ugh. We don't even say her name.
Don't make people think I'm mean.
Never.
You are not mean. That's for darn sure. If anybody around here is mean, it ain't you.
Okay.
So I got to ask you, Brett, are you an Ole Miss fan or a UT fan?
UT, for sure.
Okay.
Yeah.
Okay.
Not a fan of Lane Kiffin.
Well, then I guess you do fit in pretty well around Knoxville. That's great. Well, welcome. Now, are you going to be helping with the NEDC folks at all? Or is it just Southeastern?
Just Southeastern.
Okay. So our NEDC folks may see you around, but you won't actually be helping with them. Okay. Well, good to know. It's great to have you here.
Unless me and Brooke are both out, and then it's all you, girl.
All right. Hold down the floor.
But you know, this morning I did see the most beautiful rainbow. Everybody came in with pictures on their phones.
Yeah.
And I have to admit, I barely made it here at 8, but I was on time, Dr. Gordon,
She was.
right at 8. Because I had to stop and pull over in next to the lake where they load the boats down in off of Concord. Or is that North Shore? That's North Shore.
It's North Shore, but I know what you're talking about. Yeah.
And I got the prettiest picture of the rainbow with all the colors reflecting on the lake. So I'm going to have Mark post it just because we're getting in betas and a lot of positives and,
Oh, good.
you know,
Glad to hear it.
the negatives break my heart.
Yes, always.
But the rainbow to me this morning is just like, there's a promise and there's hope and it's just neat.
Yeah,
So I'm
yeah.
gonna post that picture.
Yeah, a lot of rainbow babies, we hope and
Yes.
pray.
Exactly.
Okay, we'll post it.
Anything else you want to throw in there?
Don't think so.
Okay, and how long are you planning to stay at Southeastern Fertility?
Forever.
For
Indefinitely.
indefinitely. Okay, so we'll count on 50 years.
Yep.
Your contract's waiting in the next room.
Well, I think that's about it then for Facebook Friday. Thank you guys for joining us. Dr. Gordon, you guys have fun on your weekend and be careful coming home. We'll see you Monday. And everybody have a good weekend.